everyone. And we have a wonderful crew here to talk with us about the caregiving conundrum. Everybody come on in, take a seat. So looking around this room, I bet we have a lot of parents here, right? How many parents do we have in this room? Raise your hand. How many of you are currently taking care of children as well as taking care of your own parents? Good show of hands. Grandparents too? Okay, well this is for you today. As our aging population gets older, we increasingly have the conversations about appropriate care for our parents as well as our children. Is care sufficient in our country now? Do we have the number of nurses that we need to provide this type of care? So we have a terrific group here to talk with us about this. First, I'd like to introduce you to Tarren Bragdon, pardon me, Tarren. He's a Chief Executive Officer of the Foundation for Government Accountability, which was founded in 2011 to advance policy solutions that open up the American dream to millions and advance free market principles. FGA has achieved more than 900 state policy reforms in 42 states. That's really unbelievable, as well as at the federal level as well. This is an inspiration. He started the organization with just $50,000 in seed money, and next year you will have raised $19 million, is that correct? That's amazing, congratulations. Next, I'd like to introduce you to Anna Jean O'Neill. Anna Jean is a healthcare executive who focuses on opportunities to support innovation, operational excellence, and strategic growth in healthcare. She serves as the Chief Operating Officer for Charter Healthcare. We had a great conversation backstage about home health care, about hospice care, things that we will increasingly have to learn more and more about with our parents as they age. She most recently joined ALFPHC1, that's an emerging senior living company, as board chairperson. She served as division president for Brookdale Health Services. It's the 6th largest home health care company in the United States. Many of you have heard of that. And she's also a registered nurse. 35 years, she holds several master's degrees in that, including one in nursing administration. Really impressive. And finally, Angela Rachidi is a senior fellow and a Rowe Scholar in Opportunity and Mobility Studies at the American Enterprise Institute in Washington, D.C. She studies poverty and the effects of federal safety net programs on low-income Americans. She has testified before Congress on many of these programs, and some of you may be familiar with the work that she's done with our former Speaker of the House, Paul Ryan, which they looked at the American Renewal Project and looked at ways that the private sector could help affect change. She also has a master's degree in public administration. Angela, let me start with you. First question. The U.S. Department of Labor recently came out with a study that said over a lifetime, women's income will be reduced by about 15% due to the caregiving activities that we all engage in, whether it be with our parents or our children. As you looked at some of these studies and the data with Speaker Ryan, what did you learn about the impact on women?
Yes, thank you. So I'll start by describing an effort that we undertook while I was at AEI with the Brookings Institute to bring together a coalition of scholars who focused on issues of caregiving. And specifically the economic impacts at the individual level as well as the macro level of caregiving. And we brought together 15 kind of diverse scholars, meaning coming from different backgrounds and ideological perspectives. And the goal of the project was to develop a consensus plan for federal policy to address paid leave to get at the issue of caregiving. And so I say diverse perspectives because we had in the room some of the top scholars, top researchers looking at paid leave policies in the country. And we combined that with people like myself who studied not specifically paid leave programs, but other federal policies that tried to address income insecurity among households. What we found, or what we really looked at as part of that group, which won't come as a surprise to many in this room, is that women often do bear the brunt of caregiving responsibilities, both for children and increasingly for aging parents. That actually is largely what contributes not only to the pay gap, but also to the statistic you mentioned, Heather, in terms of kind of economic success over their lifetime. I think one thing I'll just add to that, though, so that's not really disputable. That's sort of a fact. One thing I'll add, though, that this is something that I think we really struggled with a little bit when we were going through this project is how much of that is sort of an economic necessity of being a woman in the working world or in just in life in general, and how much of it is a choice. And by choice, I mean we see from studies that women often prefer to be the caregivers. They find it rewarding, and they, in kind of more public polling type of efforts, express a desire to both be successful in the workplace as well as to be successful parents and successful caregivers for their loved ones. And so I think that those kind of key points are really crucial when we're thinking about appropriate public policies, because it's not a one-size-fits-all approach, which often our public policies are, that it really needs, any policies need to factor in this idea of personal choice and flexibility so that women can really make decisions for their own families that are the best.
Well, let's talk a little bit about that. Anna Jean, the number of our older Americans is expected to more than double in the years to come, which puts a lot of pressure not only on our budgets at home, but the federal and state budgets as well. So how can we better prepare for the cost that is expected as a result?
Yeah, absolutely. Thanks for having me. I'm going to throw out some numbers that are probably going to be a little dramatic, but they're real. In 2021, as a country, we spent $4.3 trillion on health care. And then when you're looking at an aging population and you're looking at what percentage of that is spent on someone's last 12 months of their life, it's about 10% of that entire budget of $430 billion. And so then how does that translate to you? How do we take that to an individual? Let me use dementia as an example. Dementia is an example of a protracted health care disease, honestly, that has being protracted. It can take years in order to be able to culminate in an end of life, but also a disproportionate consumption of resources financially. So on average, an average is an average. It's not the max, it's certainly not the min. In the last 5 years of life, the healthcare costs for somebody with dementia, this was a 2019 study, was about $286,000. And you go, okay, well, I've got Medicare, I've got health insurance, I've got those. You know what, it's going to cover that. And we can't take that for granted. But the reality of it is 50% of that cost is borne either in out-of-pocket expenses by the individual or the family. And then in addition to that, you have to factor in also the cost of living and the cost of caregiving, which comes back to where we are. And so with that, it's an extraordinary financial expense, and it's a burden. And then in addition to that, it can also create really emotional burden on families. And so whether it's I have to quit my job or I want to quit my job to be able to care for someone, when you're caring for someone when they're aging and they're not able to continue to be able to function that they want, the way they want, it's very difficult. And it is, it creates its own health issues on those that are caring. So, what do we do about that? I think one hand, I can tell you, you need a financial planner. It's beneficial to be able to have a budget. And you can look at other life insurance policies or long-term care insurance. There's those things that are out there. You absolutely do need to take advantage of the Medicare and the Medicaid benefits that are there for the funding. But I'm going to take today a little bit differently and say probably one of the most important things that you can do for you and for your family is to be able to have an advanced care plan. And some people hear it called a living will, some people call it a advanced directive. But the reality of it is we have so many people in our country that live with protracted suffering and frankly futile care because they never once communicated what their end-of-life wishes are and how they want to live until the end of their life to their family and their loved ones. Thanksgiving's a great time. It's next week. Sitting around a Thanksgiving table, just think, the greatest thing you can talk about is seriously, it's like, how do you want to die?
Okay, Anna Jean, I don't recommend we talk about this at the Thanksgiving table, but point well taken, and that is advanced directives, and that's an important conversation, as you were sharing with me, to start having, even when you're younger,
right,
about what your wishes might be. Would you prefer to be in a hospital, or would you prefer to be taken care of at home? We can come back to that if we have a little bit of time. Tarren, I wanted to ask you, let's talk about the other end of the spectrum, and that is children. And you've taken a look at some of the policies, the federal government and state level policies that work or don't work when it comes to our Americans that struggle the most financially to take care of children. Where have you seen things work out particularly well, and what models might we look to?
Sure. Well, first I just want to say it's really great being here. I have 6 sisters, and so this is like being around the Thanksgiving table. It's really spectacular. So we've taken a look at this from a public policy perspective because I think a lot of times it's easy to point to a policy button, or sometimes the hardships of life would be easier if we just spent a little bit more government money. But our approach has really been to appreciate how public policy has created this rigid environment that really affects some of the lowest income Americans the most. And childcare is a great example of this. We have these really rigid ratios of how many kids can be by age, sometimes by like different for age 2 than age 3, age 4, for childcare facilities that qualify for government subsidies. But the reality is, my wife and I have 4 kids. We had a teenager who watched our 4 young kids when we went out to dinner. So think about like the world we live in versus the world we allow low-income families to live in. Our approach from a public policy perspective has been, let's create more flexibility, and let's also honor caregiving. It's not just a challenge, it's also a blessing. And so looking at on everything from welfare policy, if somebody has a work requirement, they can meet that obligation by caring for a neighbor's children. Or let's encourage teenagers to get involved in these kinds of activities by counting them towards staffing ratios and really recognizing that that kind of internship should be a meaningful activity that they contribute in high school so that they start thinking about caregiving before they ever become a parent or a caregiver to their parents.
I love that idea, and one of the things I really like about the policy circle is we take away specific things that we can do. And I love that idea about giving an internship to a young person and teaching them that responsibility. So many kids don't work anymore in America today. Let's put our teenagers back to work. Angela, I wanted to ask you about something that you touched on briefly, and that was some of the paid leave. Talk to us a little bit about the economic impact of that. There's the Family Medical Leave Act. More than half of Americans have access to that. There's some proposals to expand that in Congress. Is that a good idea? What do you think of that?
Yes, thank you for the question. So there has been a lot of attention paid to the need for a federal policy on paid leave. And when I talk about paid leave, we kind of think about it like parental leave after you have a baby or adoption, family leave, caregiving for a loved one, and then medical leave, which is an individual illness or long-term need. And so right now, the U.S. is one of the few, well, maybe the only country that does not have a federal paid leave policy. And there's been kind of a lot of debate about, well, why do we not have that? And so there have been some proposals. One was the Family Act that the Democrats proposed a number of years ago, and it comes back every year, to provide 12 weeks of paid leave to individuals for any of those reasons. When you ask about the economic impact, the interesting thing is, and we sort of fleshed this out in our working group, is that when it comes to the need for paid leave in the US, there's actually not a lot of good data, and then the data that do exist is widely misunderstood. So you will hear that only 20% of people are covered by paid leave. In reality, it's closer to about 60 to 70% of people say they take paid leave when they have one of these events. And that's because our system in the US is largely built on private businesses providing leave, even if they don't call it or have a formal paid leave policy. So it can be things like informal arrangements, paid sick leave, other things like that. And so some of these proposals at the federal level are between $50 billion a year and $200 billion a year in new taxes that will be paid to cover paid leave for workers that we already know about 60 or 70% of workers are getting from the private sector.
Okay, so you think that's overkill. We just have a few minutes left, so buyer beware. Yes. There's a cost associated with that. Tarren, I want to ask you about the caregiver crisis and how you see that sort of playing out on our communities at large here in the United States going forward.
Sure. I think that this is an area where, and we focus a lot on welfare policy at FGA. This is where we need to recognize that there are a lot of people on the sidelines right now, not into the workforce, and a way that we can respond to the caregiver crisis is to really incentivize work. Candidly, a lot of the adults on food stamps who don't have dependents are men. They shouldn't be on the sidelines. And so we need to make sure that part of our policy...
What do you mean?
Meaning they're not in the workforce at all. And because in a lot of states, and this is just going back into effect, during COVID, work requirements were relaxed. And so one of the things we focus on is step one is bringing people into the workforce because we need more workers to be able to respond to this crisis.
And maybe we can get them to be nurses because we also have a nursing shortage. Your final thoughts on what you want the takeaway to be today?
Yeah, I think one of the things that we have to do is to continue to look at healthcare payment reform. COVID was, as awful as it was, accelerated a lot of innovation in healthcare to be able to allow a remote care environment to work. The problem with it is now that COVID is over, the government had granted exceptions to allow reimbursement for these remote touches to happen. And now we're back into the level that all those exceptions have gone away, or most of them have. And so we have a severe drought of our workforce in healthcare. We have technology that can benefit patients and their families, but we don't have a funding mechanism that keeps up. So there's going to have to continue to be evolution in healthcare payment reform in order to be able to accommodate for the shortages that we have, and then frankly, be that stimulus for further healthcare innovation.
Okay, so just to sum it up, 3 quick takeaways. We've talked about teenagers, giving them potential internships to help them with childcare. That's great, gets them thinking about a future in caring for others. Buyer beware when it comes to new taxes and things like Family Medical Leave Act. You've shared with us more people actually benefit from that than we had realized, and the statistics have shown. And then finally, advance directives start to have those conversations. Hopefully not at the Thanksgiving table. That would be a bit of a bummer. But thank you for telling us about that. Tarren, Anna Jean, and Angela, thank you so much. Thank you.